Do you sometimes feel your heart race or pound for no clear reason? Imagine you're watching a movie and the soundtrack suddenly gets louder. Your body can feel the same way when a pheochromocytoma is active. This is a rare tumor that grows in the adrenal glands, the tiny pepper shakers on top of each kidney, and releases extra hormones that make you feel jittery, sweaty, or have a pounding heartbeat. In simple words, it's a tiny growth that tricks your body into thinking it's always in a fight or flight mode. What makes this tumor appear? Most often, it is a random sporadic change in the DNA of the adrenal cells. About 10 to 20% of cases run in families because of inherited gene mutations like the RET, VHL, NF1, or SDHX genes. Think of it like a family recipe that sometimes adds a spicy ingredient by mistake. Other risk factors include having certain genetic syndromes, such as multiple endocrine neoplasia type 2, or a history of radiation exposure. In most people, there is no clear lifestyle cause. It is not caused by diet or lack of exercise. A sudden scary rush of heartbeats, palpitations, that feels like a rapid drum. High blood pressure that spikes suddenly, especially when you stand up or sit down. Sweating a lot, even when it's cool outside. Headaches that feel like a tight band around your head. Tremor or shaking in your hands, like when you're cold. Feelings of panic or anxiety without a trigger. Imagine you're on a roller coaster that never stops. Your body is constantly receiving the go fast signal from the tumor. Blood and urine tests that look for excess catecholamines, the chemicals the tumor releases. Think of it as checking the fuel level in your car's tank. Imaging scans, a CT or MRI of the abdomen shows the size and location of the tumor, like taking a picture of a hidden object in a bag. Sometimes a special scan called MIBG scintigraphy is used to see if the tumor takes up a particular tracer. Treatment mainly involves surgery to remove the tumor, often done laparoscopically, small cuts like keyhole surgery. Before surgery, doctors give medicines, alpha blockers then beta blockers, to calm the heart and blood pressure, similar to turning down the volume before opening a door. If surgery isn't possible, medications can control symptoms, and newer options like radiofrequency ablation or targeted drug therapy may be used. Can you stop it from happening? Because many cases are genetic or happen by chance, there is not a simple prevention checklist. However, if you have a family history of related genetic syndromes, getting genetic counseling and regular screening can catch a tumor early, like checking the smoke alarm every month. Maintaining a healthy lifestyle will not prevent the tumor, but can help your heart cope better with any sudden pressure spikes. If you already have a pheochromocytoma, following your doctor's medication plan and attending follow-up appointments is the best way to keep future problems away. Genetic testing has become faster and cheaper, so more people with a family history are identified early. Minimally invasive robotic surgery offers even smaller incisions and faster recovery. Think of it as using a precision robot to remove a Lego brick without breaking the surrounding pieces. New drugs that block specific pathways like tyrosine kinase inhibitors are being tested for tumors that cannot be removed surgically. Advanced imaging with PET scans using 68 gallium dotatate gives clearer pictures of tumor spread, helping doctors plan treatment more accurately. These advances mean earlier detection, safer surgeries, and more options when surgery is not possible.